go.
You good?
Yep.
So the first thing that I'm going to do when I walk into the room, for my hand hygiene of course, then I'm going to confirm with my medical record that the patient actually has an order for an NG tube, so obviously we don't want to poke one in if we don't have to. Then as I walk in, I'm going to introduce myself to my patient. Hi, my name is Benjamin. I'm a student nurse from Purdue University Northwest. I'm going to be inserting an NG tube on you today. Then I'm going to confirm my patient's name and date of birth with what's on their wristband. I'm going to cross-check that to make sure I have the right patient. Then I'm going to explain the procedure. I'm going to be inserting this tube through your nostril down into your stomach to remove some of your stomach contents. That's going to help you sort of be less groggy and woozy. It's going to help you throw up less, okay? And the first thing that I'm going to do is I'm going to measure my tube so that I know how much I have to use. I can approximate it. So I'm going to measure, we'll do it on this side just to show you. I'm going to measure from the nostril to the back of the ear. And then from there, all the way down to about the xiphoid process. I'm going to mark that point with a piece of tape so that I know how far I have to go in. Now I'm going to put on gloves. Now I'm going to put this basin underneath the chin of my patient. Since we just have the head and neck of the patient and it's tilted, it's probably going to fall off. But we're just going to assume that it's staying on there. Yeah, it's as good as I'm going to be able to get it just because of the actual mannequin that we're working with today. Then I'm going to place this over the patient to sort of try to more catch anything that comes out, some waterproof stuff. Then what I would do is I would dip about 2 to 4 inches at the end of the tube in the lubricating jelly. Obviously to save the jelly, I'm not going to do that today. Then I'm going to begin to insert my tube. Okay, then once I reach the pharynx, so I have my patient's head tilted back now. Then once I reach the pharynx, I would have them tilt their head forward, sort of touching their head to their chest to sort of facilitate the movement of the tube down into their throat. And this is the point at which I would give them their glass of water, I'd have them hold it in their hand, and then with each gulp that they take, that swallowing motion, that's the movement that I'm going to use to slide the tube down, because that swallowing motion will sort of suck the tube down into the throat. And then as I'm doing this, I would be using my pen light if I had an opening here. I would be using my pen light to check inside the patient's mouth to make sure that the tube isn't curving out of the mouth and it's going down in the throat like it's supposed to. Okay, now that I've reached my tape, I know that's my stopping point. So what I'm going to do is I'm going to take this piece of tape that I've already cut sort of in half, and I'm going to secure the top part to the patient's nose, and then loosely secure the bottom part to the tube. And now as we move into the bolus part, we're going to hook up, and then we can run our suction, and we can use this to measure the amount that we get out. We're looking for color. If it's sort of a yellowish brownish, that's your bile, that's for normal. And then, but before we do that, we're going to actually make sure it's in place. So one of the things that we do, we would aspirate some of our contents into the syringe, put it into a basin, and test the pH of that. If the pH is below 5.5, that's how we know we have stomach contents. And then you're also going to verify that with an x-ray too. And so, as we move into taking the tube out now, obviously we're going to disconnect from our suction first. Then we're going to take off our tape. Then for a patient to cough, I'm just going to pull the tube out. I'm going to kink it right there so that we don't have any backflow.